you, Daniel.
Okay, good morning, everybody. As Ravi's just introduced me, it's Dan Carter here from SCC. My role is Head of Innovation. And SCC is probably the Midlands' largest technology company you've probably never heard of. But I'll start the presentation today and run through a little bit about who SCC is and what we do, and specifically what we're doing around innovation in healthcare and driving really accelerated delivery of the digital delivery of care. I will then hand over to David Kidney at about 9:50. David will talk for 15-20 minutes, then we'll cover off with some Q&A and also a bit of a view of what's to come in the future. So if I manage to share my screen in a second, bear with me. There we go. So you should all be seeing my presentation now. So let's just cover SCC. We're owned by the Rigby Group. This is a 100% owned organisation by Sir Peter Rigby, built and headquartered in Birmingham on the Warwick Road. The broader company is a diverse company, as you can see. We own interests in technology, in real estate. We have our own financial company where we help customers consume technologies away from CapEx. We own 4 regional airports, so that's Coventry, Exeter, Bournemouth, Norwich, and we operate another 3. Within those airports, we also operate a number of aviation companies and also a hotel group within the organisation. So although the technology company started in Birmingham about 1974-75, it really has seen stellar growth and diversified itself. We're one of the larger employers in the region, and actually Sir Peter and SCC, we've just undertaken a multi-million-pound rejuvenation of our head office HQ on the Warwick Road, and that will be launching in January. So I think it's fair to say that the group, Sir Peter, the family, very committed to the region and will continue to drive innovation and employment within the region. Just dialing into SCC a little bit, and SCC operates out of the UK, France, Spain, Romania and Vietnam. Significant employer, privately owned, so we are accountable to one man. We're not accountable to shareholders, where we can, you're potentially forced to change direction on strategy. So a very stable organisation, capable organisation with a very strategic line of thinking. Coming onto the point, our health and local government business is a significant business within the group. It's run, so the healthcare and the local government part is run within the same business unit, because clearly there's very clear relationships there. Roughly £100 million business. SCC, if we get to the heart of what we do, we're that cloud, data center, infrastructure, security, network, end user compute managed service company, and we deliver a whole range of these services, not just to the NHS and local government verticals, but right across the public sector and corporate sector. Specifically, my area is around innovation. So I think I'm fair to say I've got the best job in the company, because I get to go and play with the new toys that come out. But we've never seen technology evolve and come at us at such a pace as it is now. With the invention of artificial intelligence, we're seeing tech companies really accelerate and be disruptive in the marketplace. So my areas of focus are really around everything that falls under AI, with computer vision, machine learning, big data analytics, smart spaces, which fundamentally is IoT, And we're beginning to really see some interesting developments in health and social care, which I'll get to later. I think 5G is going to be fundamental within innovation and certainly around health and life sciences. It will unleash everything and be at the heart of everything. So we spend a lot of time thinking about the UK National Industrial Strategy. We spend a lot of time thinking around the NHS long-term plan and how you know, a company like SCC can complement and support those strategies and help our customers evolve and be more relevant and deliver better services to their ultimate end consumers of service. So innovation in healthcare. We work with a number of trusts and local authorities in healthcare, and the way that we approach this is definitely problem-led. So we engage heavily with the healthcare professionals within the trusts and the authorities. My mindset is always around cutting-edge technology like AI, robotics, etc. And we're principally, you know, very driven on a couple of different outputs, which is better care for patients primarily, better outcomes for patients, but also fixing operational inefficiencies, I guess, within hospitals, within trusts, because sometimes they can be actually quite easy to fix with technology, and also they have quite often a massive impact. And we always are thinking about, you know, that digital delivery of care. So very much led by clinicians, led by healthcare challenges and problems, focused on patient outcomes and operational efficiencies. We workshop with our customers to find real problems, and we take those problems through an agile but disciplined process where we can start to really focus in on the need, on the requirements, and then what SCC does is with the customer, led by the clinical side of the customer, we apply the technology to meet the requirements. So we're led by the customer on requirements. We take ownership of the technology, and we take that through a process until we have a product or service. At then which point the customer, we get to a point where it is consumed as a product or a service. Right the way through the process, you have to be agile. So you can stop and rewind or stop the project, right? Because the world changes rapidly. Very much focused on cutting edge technology. So yeah, I think, you know, starting with the problem and work backwards, I think you have to be stubborn on the vision, but very flexible on the detail. And you've got to be willing to fail. Just make sure we fail fast. Is key in our learnings. I take a little bit of inspiration from someone who kind of knows what they're doing, Jeff Bezos, which is, you know, we've all probably been there where we've spent months, potentially years building a product, and then you throw it to your marketing and sales teams, and by the time you've actually potentially, you know, sold something, the world has changed and the requirements have changed. So again, you know, led by customer demand, work backwards from there. I think today was really around sharing my appetite and vision to engage with the startup community within the region. I think partnering with partners from my perspective, from SCC's perspective, is really important. You know, large companies are always under attack from smaller, agile startup community companies. For me, they generate a really interesting discussion point with my customers. We're not in the business of developing companies, startups. We're not in the business of particularly coding products, to be honest. So to have an exciting, relevant, innovative community of early stage companies around me is really interesting. It expands our footprint of offerings to our customers. it reduces, customer churn. It helps, I can build services around these companies and these products. So they, I see, an engagement with the region startup community as a proactive strategy that I want to engage in, because it adds me a lot of value. Why am I attractive to a startup? Well, it's pretty basic stuff, right? I mean, I can really accelerate the growth of a startup company if we get the recipe right. I can give you access to, the 9,000 customers we have in the UK that a lot of them we've got over 30-year relationships with. I give you access to capabilities that startups could only dream of, like access to sales teams, marketing services. Our brand is recognized and trusted. I have many thousand people, engineering, professional services, managed service capability. We are on every framework that exists within the public sector. We can create bids and inject startups into our bids. And of course, we are, a wealthy company that potentially we are interested in potential funding opportunities. So, there's definite benefit for both parties in engaging with the startup community. There are things that we need to consider, though. Culture mismatches. That word culture, it's absolutely the most important statement to make, because it defines absolutely everything. So culture mismatch is definitely a real issue. Aligning, your priorities, objectives, a difference in risk tolerance, I think is also key. And of course, the smaller companies are much more agile than a company like SCC, and that can drive some challenges. But going into this relationship with eyes open, and if you do find the right recipe, then it really can equal success for both parties. So just to focus on some of the outputs that we've delivered recently. So these are principally, with exception of one or two, these are all enabled by startup communities that we've accelerated through the SCC engine. Assistive technology in the home. The problem statement was, could we put technology in the home to remotely monitor, reduce the opportunity of people declining in health and therefore using services, NHS services. If we fast forward, we have now a mid-stage company that we have a very strategic relationship with. We have funded a reasonable sized scale deployment in a dementia cohort within the Midlands community. These are IoT sensors: chair, bed, wristband, toilet, door, fridge, food cupboards, tap, kettle, and we monitor things like mobility, anxiety, hydration, nutrition, sleep, and the AI builds a unique identifier baseline for that individual through consent-based apps, next door neighbours, family members, members of the bridge club, whoever, can start to see notifications of decline. So you can interject early and stop that decline accelerating. We've had the first 2 months of data back on that, and it's really looking encouraging. We're seeing, like 40% reduction in home visits, 50% reduction in GP, 30% reduction in hospital appointments. So it doesn't take wild imagination that if that was rolled out across the region, it would radically transform the way that care is delivered digitally. Computer vision, we're just starting a project with a local authority, NHS Trust, in scanning millions of images to find potentially adrenal lesions that have been missed historically, glaucoma that has been missed historically, and also abnormal scans of chest. So there's a number of projects that we are actively accelerating with startup communities through the broader engine of SCC. And yeah, we're open for business. We're inquisitive to see what's out there. We're very focused on the region. So really happy to kind of engage in further discussions. So that's the end of my 15 minutes. So I think it's time now that I actually hand over to David, unless we have any questions.
Well, I think we've got time for two questions that have been raised, Dan. So one of them is on 5G. Do you worry about the conspiracy theorists who oppose it? And so I've been working a lot with the WM5G team across the West Midlands, and there has been opposition, resistance to the building of masts, blaming it for a role in the pandemic even. So that's the question about, have you got any worry about that? And secondly, what is it that keeps SCC rooted in the Midlands?
5G conspiracy theories, anti-vax conspiracy theories. Where do I? So no. I generally trust the government advice. I think there's better people out there to ask this question to. But you know, 5G is being rolled out nationally, globally at scale. I'm not the right person to comment on the intricacies of the health.
How about a different slant then? Is it a good thing that the West Midlands is now embracing this and looking at the technology to adopt it first? Because obviously there's going to be a lot of innovations that will be developed and rolled out from this technology, and from many of the stakeholders we're talking to, they are looking at 5G as one of the key factors that will help develop a lot of these new innovations.
The benefits of 5G will transform industry and transform the economy of the UK. It is the 5th generation, not 5 gigahertz. There's a massive amount of misunderstanding of the 5G frequency and its effects on health. It's a rabbit hole. The benefits of 5G will far outweigh the negativities. Yeah. So the second question was,
what keeps SCC rooted in the Midlands?
We've been here for 40 odd years. We've had multiple reasons to. So we've had multiple opportunities to upgrade, I think, over that period of time. But we are where we are. The family is Midlands based. We've been here for 40 plus years. We own a significant amount of the buildings that we operate in. We are committed to the region, and that's not going to change.
Thank you. We've got a question from Alan, which is, are you planning to publish your IoT evaluation, and how will you scale up to a more robust evaluation?
Yeah, so we did actually publish. We were in the Guardian's digital health supplement. I think it was about 3 weeks ago, which I'll share. I've got the PDF of the story. So I can share that with you after this call. But the next step is, that business case is quite frankly outstanding. We're about to pull the trigger with this trust to go into probably about a 500 cohort. And if the same data or similar data, because we don't need 40 and 50% to build a business case, right? It can be 20s and 30s. It's still transformational. That will go to the many thousands. And we're already beginning to work with other Midlands-based trusts. And we'll promote this heavily. So you will see this within the cluster and the region's tech communities.